Welcome to WeLearn, Virtual Learning Network. This is session number 22, Medical Termination of Pregnancy and Issues Associated with it. Topics which we are going to cover in this session are abortion, definition and types, methods of procuring an abortion, liberalization of abortion leading to legislation, Medical Termination of Pregnancy Act 1971, that is MTP, issues and controversies associated with legal abortion, religious views. So coming towards the first topic, that is abortion, definition and types. Abortion means taking away a human life which would in the normal course of event be born. Abortion has two meanings. Medically, it can describe a case of miscarriage occurring within the first 3 months of the pregnancy. Abortions legalized by the Act, on the other hand, are those deliberately procured with the intention of terminating the pregnancy. The term abortion and miscarriage are sometimes used as synonyms, killing the unborn child. Abortion is restricted so as to describe the case occurring in the first 3 months of pregnancy, and miscarriage to describe one during pregnancy from the beginning of the fourth month until the fetus becomes viable. Now moving towards the types of abortion. There are 3 different types of abortion. These are spontaneous abortion, indirect abortion, artificial and induced abortion. So the first one is spontaneous abortion. It is occurring naturally without any deliberate attempt on the part of pregnant women or other persons. Indirect abortion. This is an abortion which occurs as a side effect of treatment given to the mother for some disease which is endangering her life. The purpose is not to take away the child's life. It occurs as the result of the measures taken to save the mother. Third one is artificial or induced abortion. It is taking away of life for the main purpose of removing the fetus or child. Methods of pre-occurring an abortion. There are many ways of aborting an unwanted fetus. The method chosen depends mainly on the duration of pregnancy to the interrupted, as in the first or the second trimester. The first trimester. In the first trimester of pregnancy, 2 broad methods are used: medical and surgical. In the medical method, 1 single dose of mifepristone pills administered within 40 days of menstrual period. Whereas in surgical method, different ways are used. Number 1 is menstrual regulation using MR syringe. Second is suction. The most frequently used method of abortion is suction, also called vacuum aspiration. It is used when the woman is less than 3 months pregnant. Next is tent evacuation with laminaria tent. Fourth one is dilation and curettage. This procedure involves increasing the size of the cervical canal by inserting a series of gradually widening metal dilators. When the opening is wide enough, the physician uses the curetage to scrap the embryo and placenta from the walls of the uterus. Now coming towards the second trimester. In the second trimester of pregnancy, only very few methods are usually adopted. Intrauterine saline instillation is one method. After 12 weeks, the fetus is large enough to be reformed safely by the suction or DNC method. Pregnancies after this period are removed by inserting a long needle abdominal and uterine walls into the cavity of the uterus. A concentrated salt solution is inserted into the amniotic sac. Destroyed, the uterus will contract until the fetus is pushed out into the vagina. Because saline abortion is a major surgical procedure, earlier termination of pregnancy by the suction method or D&C is being recommended by the physicians. Hysterectomy. This is used in the later stages of the pregnancy when the fetus is too large. The mother is given a general anesthetic and the uterus is cut open and the fetus is removed. Consequences of illegal abortion. Now we will study the liberalization of abortion leading to legalization. Illegal abortions frequently led to complications such as preformation of uterus, hemorrhage and infection requiring gynecological care and hospitalization. Now the attempts to legalize abortion. The Soviet Union was the first country to legalize abortion. In 1920, Lenin's government enabled women in the first trimester pregnancy to obtain abortion on request. Thereafter, many consequences introduced liberal clauses in the abortion laws from 1930 onwards. Presently, the law on abortion vary from abortion on request at one extreme to total prohibition on the other and Soviet Union. Next is the Medical Termination of Pregnancy Act 1971. The Medical Termination of Pregnancy Act 1971 lays down three norms terminating a pregnancy. The first one is the condition under which a pregnancy can be terminated under the MTP Act 1971. There are 5 conditions that have been identified in the Act. These 5 conditions are: number 1, medical; number 2, eugenic; number 3, humanitarian; number 4, socio-economic; number 5, failure of contraceptive devices. Second is the person or persons who can perform abortion. The Act provides safeguards to the mother by authorizing only a registered medical practitioner having experience in gynecology and obstetrics to perform an abortion where the length of pregnancy does not exceed 12 weeks. However, where the pregnancy exceeds 12 weeks and is not more than 20 weeks, the opinion of 2 registered medical practitioners is necessary to terminate the pregnancy. Third is where abortion can be done. The Act stipulates that no termination of pregnancy shall be made at any place other than the hospital established or maintained by the government. Now coming towards the MTP rules. Rules and regulations framed initially were altered in October 1975 to eliminate time-consuming procedure involved in MTP and to make services more readily available. These changes have occurred in 3 administrative areas. Number 1, approval by board. Number 2, qualification required to do abortion. And number 3, the place where abortion is performed. Now coming towards the limitation of the Act. The value of human life is challenged. Number 2, no consideration is given to the right of the fetus. Next are the issues and controversies associated with legal abortion. Abortion raises some difficult questions to which there are no simple answer. Abortion issues may be divided into physical and medical, psychological, social, moral and religious. So coming towards the physical and medical issues. A woman is made physically and psychologically for motherhood. This is the basic fact of her life. If this process of becoming a mother is suddenly stopped, the shock will have its effect. The effect may be physically or mental, immediate or long term. Next are the emotional issues. There is emotional and physical unrest experienced during the first few weeks of pregnancy. Most women even experience feeling of rejection of the pregnancy at this time. It is at this time that the expectant mother may be subjected to maximum pressure to agree to an abortion. Legalized abortion saves life by reducing the number of illegal attempts. Anti-abortionists emphasize their fear that without any restrictions except the individual woman and her consequences, an abortion mentality develops so that abortion becomes too common and are performed too easily or for reasons that are not serious. Next are the moral issues, rights of the unborn child. Much of the controversy about abortion has centered around the moral issues involved. In ordinary justice, the child has as much claim as the mother to life and should have even more claim to legal protection of its right, since it is incapable of defending itself. Rights of an unborn child. The UN Declaration on the Rights of the Child maintains that the child, by the reason of his physical and mental immaturity, needs special safeguards and care, including appropriate legal protection before as well as after birth. The anti-abortionists claim that science has proven beyond any reasonable doubt that human life begins at fertilization. The fetus from the beginning has its own life. It is totally new human being, a new person with a genetic code quite distinct from the genetic code of its parents. The only life generated by human being is human life. That new life is completely there at fertilization, lacking only development and growth. Abortion always takes away an innocent, already existing life. Next are the religious views. The ethical views of different religions have always condemned the violation of natural law, the laws of the Creator. The Hindu view. According to Hindu religion, a woman who undergoes an abortion in this life becomes barren in her subsequent lives. Hindu scriptures condemn abortion and consider it as a murder. According to Hindu Vedas, abortion is considered to be a more serious sin than killing of a Brahmin. According to Shastras, life begins after the 4th month in the womb, when a ceremony is performed blessing the fetus which is already living. The Islamic view. The Holy Quran warns men not to interfere with the work of God. It is one of the basic teachings of Islam that life is a gift of God, and as such no man has any right to commit any kind of act that is detrimental to an exhausting life. It is on the faith that Muslims generally oppose abortion, as it is felt that it amounts to extinguishing of life. The laws of Islam under certain circumstances prohibit abortion when the fetus is animated and considered a living being. Abortion is allowed in general during the first 90 days of pregnancy, and it is prohibited immediately afterwards. Next is the Christian prospect. The Christian Church in the 1st century after Christ forbade abortion under all conditions from the moment of conception, and abortion at any time is considered a grave sin. Direct abortion of a fetus before viability is never lawful, because this is to kill an innocent human being who has a right to live. The views favoring legal abortion are: women should have the right to control over their own bodies. No child should be brought into the world unwanted. Legal abortion should be conducted in authorized medical settings in which considerable care is taken to avoid harming the mother physically or psychologically. Women must have the option of the safe, legal abortion if they desire. Now, the views against legal abortion. Fetus is a living being, and therefore its right to live must be respected. No one has a moral right to take that life. Next is, persons other than the mother have rights as far as the unborn child is concerned, child itself and the father. Now, in the last, there are a few questions which are based on this session. Question number 1 is, what are the rights of unborn child? And question number 2 is, what are your suggestions to prevent unwanted pregnancy? That's all for this session. Thank you. Happy learning, we learning.